digital nerves on each side of the toe. And there's another digital nerve here that's on the lateral side of the toe, and one more on the bottom of the toe. Do you feel that up there? Okay. And one more on the bottom. We did a little bit of numbing before. We're just making sure she's completely numb. We were afraid she might not be 100% numb, but that's the numbing technique. One nerve here, one nerve here, one nerve here, and one nerve here. So there's 4 digital nerves that get the whole quadrant. Most of the nerve endings to the toenail actually come from the 2 plantar nerves, and they give you a lot of the feeling to the toenail bed itself. So those are the main ones. Really dropping it down here is the main thing. That's why I went on the side here down to the bottom, and you can see where the local anesthetic is, because it gets a little white. There's a little bit of epinephrine in there. That's how we know that it's numbing the area. So now, not only does it numb it, it also keeps it from bleeding, the epinephrine, and that creates a drier field. We want a dry field, so when we put the chemical there, the chemical will take and it doesn't get mixed in with the blood and dilute it. So now we're gonna wrap the toe. We're gonna use a tourniquet. I'm gonna grab a different bandage here that's open, and we use this to exsanguinate the toe. This is actually exsanguinating, is pushing the blood out of the toe. And I'm pushing the blood out of the toe right now. It's already vasoconstricted, which means that arteries in the toe are constricted because of the epinephrine that's in the local anesthetic. And some people ask about the epinephrine. Is it safe to use epinephrine in the toe? If someone has a vascular issue, we don't use epinephrine in the toe. But in this case, and I'm actually putting a big bandage scissor in here right now. In this case, we can put epinephrine in her toe because she does not have vascular compromise. There's no issues with her vascular system, so it is okay. So we're gonna pull this back, and I try to do this, it's real tight, and that's what I want. I want it to be real tight here. Because like I said, I wanna create a dry field. So now we have a dry field, we're ready to go. We're gonna get the sides of the nail out. Both sides are a problem for her. So we're gonna loosen them up here. And first we'll do the medial side. And it's actually pretty tight in here too, and I can see this side's actually pretty bad. Now we're gonna do the lateral side. And I'm gonna shove this under the nail, just like that side. And this is real thick here too. This is from trauma to the nail. She also has fungus in the toenail. That's a whole nother issue that we can address later on. Fungus is really difficult to get rid of. So now we're gonna loosen this nail pieces up. And I'm gonna take this much of the nail because it's thicker and I wanna make sure I get enough. She's had this for a while, and I'm pushing down to the epinicium. Now I know it's loose back there. I wanna make sure I get all of it because the epinicium, which is under the cuticle, is where the nail grows from. And now I'm gonna get the lateral side. I slide it under and I clip, and her nail is very thick, so I'm actually pushing pretty hard on this. And now it's loosened up. Now, the fun part, the best part of the procedure. And my assistant Alexia is laughing because this is where we take the nail out. And this is also the most satisfying part of the procedure when we see the nail come out.
It's just wonderful.
And even the patient thinks it's wonderful. So this is the wonderful part of the procedure. We turn the nail and we pull and we get this nice satisfying chunk of nail out of there. And you can see it coming out. There's a little bit of callus attached to it. And I'm gonna pull that out. There's the piece right there. Nice big chunk of nail. And I still see a little bit of a tail to it, or the callus that had formed on the side. And we're gonna get that off of there. And it's actually not as bad as I thought it would be. I thought there might be more callus there, but her nail is just very thick. And that's the main issue here. So I'm gonna see if there's any more stuff to pull out of here. And it actually looks pretty clean right there. Now we're gonna get the other side, the second most satisfying side. Now this you can see right, just looking at this, how thick that piece of nail is. I'm sliding it under, and again, we're gonna turn it, and we're gonna pull this piece. This is where it's big chunk of nail. This one's actually worse, this side of the nail. Was this your worst side for you?
No.
Okay, this side actually looks worse, and it's a thicker piece.
Ew.
And you'll be able to see, can you see how big it is? Yeah, you can see on the screen how big it is. The patient's actually looking at the screen as we're filming. So, big piece of nail. It's gonna be very, very much of a relief for her because it's out of there, especially on both sides. But actually right now the nail looks great already, just with the pieces out. And my assistant Alexia even agrees that it looks great right now. But we're not done. There's more. We get to put the chemical here. So we're going to do 3 sticks of the chemical. We will put the chemical here for about 10 seconds on each side. And you can see it's causing a chemical burn. Causes the tissue to turn white. And if you look closely, you can see the tissue turning white. And that lets us know that we are causing a chemical burn to the nail matrix. And that's exactly what we want to do, is burn the nail matrix and kill the cells there so it won't produce any more nail cells and it won't produce any more nail on the side of the toe. And we're getting this nice and clean here, and we're putting just enough of this medicine here, which is the sodium hydroxide, to burn it, just a little bit at a time. We don't want too much. You can get a little bit of a reaction from the chemical, and it just would cause more drainage and more redness and more swelling of the toe. So there's the 3 sticks. Now we're going to do the other side of the toe with 3 more sticks here. Okay, so we'll dry this off. We make sure that the field's dry again, and you'll see right away, you can actually see it. See it's turning white under there? Can you see the white? That's the chemical burn right there. So we know we're killing the nail cells. And the 10 seconds is just an arbitrary number that we pick, but we know we don't want to go too long on it because it'll, again, we get that violent reaction. It's not that violent of a reaction, but it does get significantly more red if you put too much of the chemical there or you do it for too long. So really we do it by the looks of it too. And I can see that it's doing what it's supposed to do, and that's burning the nail matrix. And we have 1 more stick here. And this is it, and then we will flush it. And the reason we flush it is if there's too much chemical in there, we flush it out. We know that it's already done its job. We can see that it's done its job because it's white. So we'll flush it out with some vinegar. And we just use a little bit of vinegar in a dropper here. We're gonna do both sides. And that's it. Now we know it's flushed out. It's still gonna drain even though we flushed it out because of the burn. The body reacts to that. So we're now gonna put some Sylvanine cream on there. And this is the final touches of it. And then we'll put a dressing on here. And that will be it. So basically the dressing, not that interesting to see. So we're not gonna film the dressing. We're gonna put a special one on there for her. But that's the whole procedure. Another nail surgery done, another satisfied customer, and another satisfied patient.
Awesome.